At 8 a.m. this morning, nurses and healthcare assistants walked out of Nobles Hospital for a 12-hour strike. This follows on from an ongoing dispute with Manx Care over fair pay and working conditions.
Our members reluctantly are striking today. This is the second bout of industrial action, and we really hope there won't be any further action, but action is planned for October, another 2 days of action for October. We really hope that the government will talk to us and come with a reasonable and realistic pay offer for our members, so they don't have to take that. Our members don't want to be here today, they don't want to be on strike, they want to be on the wards, but they also want safe and effective care on the wards, and they're not delivering that each day because of the staff vacancies we have, and the staff vacancies are a result of pay.
Why aren't RCN interested in arbitration with Manx Care?
We're interested in finding a resolution. What we're not interested in is finding a resolution where there's going to be a preconceived notion that any offer that is made has to be accepted. So we want to go into viable, constructive negotiations. We are not putting a figure on this. No, we're open to negotiation. We're not being unrealistic, but we need a negotiation that is a proper negotiation and consultation, not going into a preconceived set of ideas that we will have to agree to at the end of it. That is not going to solve the problem. It's not that we don't want to negotiate, it's just that we have to have a negotiation that's going to solve the problem. And going into a negotiation which means that we get a result that isn't going to solve the problem is a waste of time.
Can you just tell us how you feel the working conditions within the hospital are at the minute?
The working conditions can be very challenging. We've got lots of patients with multiple conditions, and we're getting more and more of the poorly acute patients through the hospital. The nursing staff are just working full pelt, working additional hours. They're working above and beyond really of what their role and responsibilities are, but not outside of their scope. And we just feel the pressure constantly. People are quite down, quite upset that they can't look after their patients properly as they should, as they've been trained to do, because there's just not enough people.
We know that our nurses will go to work tomorrow with probably fewer staff than they are on duty today, and having to do more work because today they've stepped down things like outpatients and some of the elective surgery and things that can wait. So tomorrow it'll be full blown, and they'll say oftentimes, there's 2, 3, there's always a call out for staff to cover shifts, and there's always a gap, uncovered shifts. So I think it's a little bit disingenuous to say that industrial action is making staffing less safe.
I'm striking today for fair pay and for safe staffing, really. The government has recently produced a document that states quite clearly that the living wage on the Isle of Man is over £12 an hour, and our healthcare assistants' starting wage is £11.23 an hour, and I actually think that's a bit of a disgrace that the government can say you have to earn this much to survive on the Isle of Man and then pay their employees less than that.
At the very basic level, it's about fair pay for the nurses who are currently working in the health service on the Isle of Man, and larger than that, it's about retainment and recruitment of other staff as well. It's a 3-year degree course, and it's a large amount of effort and time that people go through to become nurses. And we're not going to encourage people to do that unless we can pay them appropriately. So the service is going to suffer, and therefore patient care is going to suffer in the future.